Hey guys, it's Dr. Emer. We're here doing a maintenance treatment with one of my beautiful patients, with my long-term client, and I feel like as time goes on, she doesn't age because we're doing things that just maintain her overall facial shape and tightening. We're talking about bigger treatments going on in the future, but for now, because she lost a bunch of weight recently, we're noticing that in a lot of patients that are taking an active change in their lifestyle, that weight has now lost a little bit of volume in the face. Although things we've done in the past, you've seen threads that we've done with her and some fillers, has really helped maintain her face even with the weight loss. But certain areas like the temple here, the submalar area, and the areas around the mouth, you could see this area here, tends to get a little bit looser when you lose this volume.
People say, I'm coming to see you soon.
I can't wait. So we're gonna regenerate, we're gonna rebuild those areas, and we're going to focus first from up top all the way down. And we're going to use Radius in the temple. This is one of our thicker, more lifting fillers. I like it because it lasts a lot longer and it builds collagen in this area as well, and she needs to see that immediate volumization. So if you look here to there, compare the two sides, you can see already a big improvement, just that small amount of volume. We're going to do that same thing here. You see when there's a concavity here, but you have nice elevation in the cheek, you really want to get this area to be filled because that's what's going to balance the OG curve and also help the brow area.
If someone wants to lose weight, can you talk to them about what to do?
Yeah, I mean, we have patients on GLP-1 agonists like semaglutide and Wegovy, and you could use those. We also have other peptides that help people lose weight. I'm on one called MOTS-C. It also increases metabolism. It helps athleticism. There's other things you could do too for muscle toning and skin tightening that I just talked to her about today. But there's a lot of things we could do to enhance weight loss and get rid of problem areas of fat like TrueSculpt, Kybella, Lipo, etc. So definitely contact us because we can do semaglutide and other weight-reducing medications to help you if you're struggling. All right, we're going to go do a little bit more in the temple. So we're going to do a little bit more in the temple. This one I'm going to go a little bit deeper because I want it to blend. It's going to sound weird. There we go. Perfect. You see the idea here is to blend that into her cheek. Same thing here, we already did a little bit more at the height here. I just want to get a little bit higher at the fusion line, just a small amount, and then we'll go down to the deeper portion. And you could even go back, because you see if we add volume up here, look what it does to the brow. Same thing with threads, as well as filler into the brow itself. But now the temples, show them the temples, look a lot more soft and a lot more healthy. She looks more vibrant now that there's volume there. Look up a little to your chin, just a little. Now we're going to use a softer filler. This is one of the few fillers that's actually injected dermally. This is called Bellatero Balance. I like this for patients that don't want to look like they have a lot of filler, just soft, fine wrinkles that we're going to improve. What you want to do with this filler, especially if you're treating fine lines, a little bit different than when you're treating a fold, but if you're treating a fine line, you'd want to do small blebs. You could see those blebs. They'll pop out. We're going to get the marionette area. I just want this whole area around the folds to improve because I don't want her to feel like the corners of the mouth are turning down. And then what we'll do is we'll have Nisha the PA use a Q-tip to kind of blend it in.
When are you coming to New York? You'll be there February 12th to 17th.
Perfect. So see, she'll rub that in. I'm going superficially. There's different ways to utilize this and in different areas, and you can do it again for areas that you want some level of softening, like I was saying here around the marionette, just to soften and plump.
And where in New York, our location, we are going to be on 57 and 6, right on top of Quality Italian. If you need our address, guys, send us a DM, full name, email, phone number. Our team will reach out to you.
Feel free to send Quality Italian for lunch anytime.
Yes, if you show up and want to bring food, more than welcome.
Jordan would love it. He especially likes the chicken parm pizza. And we love the desserts as well.
And what are the doctors asking again? Aspirating again. Every live we do, they ask us.
Oh, wow. Well, I guess they're not reading the literature. It's all right. She's going to rub that fold now. And so that we just did for...
Someone said it's not a filler. This is filler.
That's a filler. It's just a very soft one. Now, we did that to just soften the sort of fine lines around here so she didn't feel as heavy. Look up again and look this way. So now what we're going to do is this area here on her face is starting to get a little hollower. So we're going to use our SCULPTRA. This is our PLLA. So this will build collagen over time. She's going to look really sort of swollen here because we're injecting this in a larger volume, sort of cross-hatching in this area.
The cheeks are so beautiful when she smiles.
She is. She's very beautiful. They're partially hers, partially mine, okay? We've created those over time. And so my goal is, again, to soften that area. Now with SCULPTRA, I'm going to show you guys SCULPTRA. We like to use this pan facially. So what I'm going to do is keep that jawline really tight. We're going to use it. We just did a little bit in the submalar area. We're going to do a little bit on this posterior portion by her jawline. This will help pull back. In front of the ear is a really good area because this builds, again, this pulls support and pulls everything back. And we just do very small amounts. Now today it's going to look super swollen because this is a larger volume. Okay, and then her cheeks already naturally look good, but we're going to put a little bit in there to kind of just pull everything back. Perfect. So now amnesia from on that side and she'll massage. Come on this side, all right? So just now the key is to massage. So we're going to turn this way now. And again, you guys see this is the submalar area. So we're going to do, this is called a scaffolding technique.
SCULPTRA guys like to use this in many parts of the body.
And you could use this for buttock augmentation. You could use this for fine wrinkling in certain areas like the chest, elbows, knees. Hold there for a sec. I'll take that. And then, no mistake. What it is a powder that's mixed into the solution. So you guys see that here, those little particles. Those particles will build collagen over time. This is not going to be for immediate volumization, although it looks like she has some volume. It's not. This is just the fluid in there. It's allowing the SCULPTRA into the body, into the skin. Again, I'm going to use a little bit in the temple, and then I'm staying over here still. So we're doing this pan facially, and this should be done when people have lost weight or they need more volume. You do 1 or 2 sessions a few months apart, and then you go every 6 months a very small amount. Again, we want a small amount lateral cheek just to keep the support.
What time is it for us? It is about 6 o'clock. Where are you coming from? Can you do filler and SCULPTRA on the same day? Yes, you can. If you were on earlier in the live, you'll see that we did some filler in the temples. We did filler around the mouth, the folds, with a more thin filler, more soft filler in bilateral.
Almost there. just do a little bit. Now the chin will look obviously strange today because there's numbing medicine here. So inside, so it'll be hard for her to speak. And it's gonna look a little large, but because there's volume. But that's gonna help give support. And then the last part we wanna do, again, is add a little bit to temple. We did the temple already. Add a little bit more here. And then a little bit more to her submalar area. Perfect. And then a little bleb into temple. Perfect. So now, when people leave with the SCULPTRA, they look all full and it's hard for them to speak. It doesn't look like fillers, you guys. Fillers can kind of look contoured and look very natural. With SCULPTRA, it looks a little unnatural because you're injecting a lot of volume. But if you could see overall, the whole point is lifting. So lateral cheek to pull back, lateral jaw to tighten, around the mouth to give support, and chin to give support in the area we age. As this kind of closes, we want to keep this balance, and the folds. And the submalar area where she lost weight, we want to build that volume, so we injected the SCULPTRA there too. So this is panfacial volumization, sort of panfacial enhancement, and then softening with some fillers to just keep her looking very beautiful. So do a pan to show them, and we will follow her up in the next couple weeks. Okay. Perfect.